Hi everyone, my name is Shina. I'm in the bachelor's program at Miami-Dade College, and today I'll be talking about manual therapy, specifically acupuncture. So with acupuncture, it comes from a traditional Chinese medicine, and this often involves inserting thin needles into certain parts of specific points on the body. These points are believed to help regulate energy flow, which is often called Qi, and it stimulates the body's natural healing process. For Western medicine, acupuncture is often explained as stimulating nerves, muscles, and connective tissue, which may boost circulation, release tension, and trigger pain relief pathways. So, a little history about acupuncture. As I said before, it's believed to have originated in China thousands of years ago. The early forms of practice is 2500 BCE, and it's during a period called Neolithic period. During this time, they didn't have needles, so they would use sharpened bones or sharpened stones to stimulate the points on the body. And then for the earliest written record of it, it does appear in a book called The Yellow Emperor's Classic of Internal Medicine, which was written around 200 BCE. So, with acupuncture, there are benefits to it. So, one of the biggest benefits of acupuncture that many people do it for is pain relief, especially when it comes to pain for neck, back pain, headaches, joint pain, just all, just pain in general. A lot of people do acupuncture for that. Another benefit of it is stress reduction. Many people do say they experience deep relaxation during their sessions. This is due to it helping the body regulate the nervous system, it reduces stress hormone, and just improves the overall emotional balance. Acupuncture is also known to help with anxiety, sleep, and mood. There are studies that showed that acupuncture does help relieve it, and it does it again by calming down the nervous system and improving sleep quality. It's also used for support, recovery, and healing. It improves local blood flow and it reduces inflammation, which can support recovery from injuries and chronic conditions. And then another thing is it may assist with digestive or hormonal issues such as like your period imbalance, menstrual pain, or IBS, which is irritable bowel syndrome. It's known that it can assist with these things. And then like with many manual therapy or any therapy in general, there are risks. With this, there's not a lot of risk, but there are some. Some that I found were soreness or bruising after the fact. And these are where like the needle sites were it punctured. It should fade within an hour or a day. Another one is fatigue or lightheadedness. Some people reported that they felt tired or slightly dizzy afterwards. And sometimes symptoms may get worse before they improve. Another risk is risk of infection because once again, there are needles going into your back, but this risk is it's not a common risk, and the needles that are used are sterile and properly used. But once again, if the practitioner isn't following safety protocols, there is a risk of skin infection. And then, like every therapy, acupuncture is not suitable for all conditions. Certain conditions, such as bleeding disorders, or if you're taking blood thinners, or for women who are pregnant, you might want to ask your health provider before wanting to do this. So all in all, acupuncture can be an amazing thing. It can be very beneficial, but like every other therapy, there are risks to it. So just before you want to do it, just make sure you talk to your healthcare provider to make sure it's right for you. So yeah.